LEAPS ought to be an educator's best friend when it comes to the behavior improvement plan. When you have an IEP or an individualized education plan, concomitant to that, you need a behavior improvement plan. The two go hand in hand. When you have a deficit in one, you're obviously going to have at least some sort of deficit in the other. A behavior improvement plan is supposed to identify not only the behavioral needs of the student, but what you're going to do about it. And regulations say you need to be able to graph that. And that can be difficult when you're trying to do everything from an anecdotal standpoint. When you have these, behaviors that you want to change, but you don't have a mechanism of change, you end up creating change measurements that are really hard to actually put a value to. And in fact, under most initiatives, whether you're doing RTI, MTSS, any of these, is that you're supposed to have quantifiable data to do so. So in a behavior improvement plan, what LEAPS gives you is the entry-level functioning of that student, breaks it down into categorical areas, gives you quantifiable data from an overall functioning standpoint as well as that categorical standpoint. So there's quantifiable data. Then what LEAPS does is it gives you that data in a graphical representation format, a Likert scale for overall, which is a 1 to 5 measurement. It gives it to you in two different graphical forms on the categorical, both a line graph as well as a scatter plot, so you can actually sit down with a parent and say, look, here's the line of demarcation. Anything above this line, that's good functioning, we're okay there. Below this line, that's where we're going to work, and things become relative on that. And then based upon both relative and normative standards, you can communicate that to parents. And LEAPS goes a step further for the behavior improvement plan. It actually gives you a lay interpretation of every category of needs, area of need. That means it tells you what to tell parents within an area of identified need. Next, it breaks it down for you into raw data per category, which helps with small group development. And then obviously it tells you what skills to teach. So from a behavior improvement plan standpoint, LEAPS tells you the student's level of functioning. Then it breaks that level of functioning down and tells you, based on this level of functioning, here's the level of likely risk and behavioral severity you're likely to see. So you identify, these are the kids I need to focus on. And then from that, here are the areas we need to focus. And then from that, here's how I communicate it to mom and dad. And then beyond that, here's what I do about it. And so LEAPS is a great tool, whether it's for your behavior improvement plan, your functional analysis program, your FAP, any one of those BIPs, FAPs, IEPs, fits perfect.